Hello and welcome. You're listening to the Sickle Cell Action Network, a weekly internet radio show presented by Martin Center Sickle Cell Initiative and sponsored by Mast Therapeutics. We're coming to you live from Indianapolis, Indiana, and we're here to serve you by providing up-to-date information and opinion on all matters pertaining to sickle cell disease. My name is Gary A. Gibson, and I am your host for the next 2 hours. Let me start by saying that I don't have sickle cell disease, nor do I carry the sickle cell trait. In spite of that, I am no stranger to sickle cell. Quite the contrary. You see, even though I don't have sickle cell, it has had a very huge impact on my life. That's true because its complications took my wife from me after 12 years of marriage. It also caused her to have a miscarriage that resulted in the loss of our twin babies that she was carrying while in a sickle cell crisis. So all told, sickle cell has taken 3 lives from me, and I feel the pain of those losses every single day. I currently serve as the president and CEO of Martin Center Sickle Cell Initiative, a community-based organization that has been serving people with sickle cell for over 45 years. Each day I attempt to transform the pain of my losses into positive energy that is focused on making a difference for those who are battling sickle cell. From being involved with sickle cell for over 40 years, I'm able to say that much progress has been made, but there is still so much work to do. This show is an opportunity to contribute to the ever-expanding dialogue about sickle cell that is taking place all around the world. Our show is about raising awareness, but it is also about so much more. I like to say that sickle cell awareness is important, but we need more than awareness. Those living with sickle cell are already aware. That makes me ask, so what are we doing for them? My answer is, not enough. That's why we've named this show the Sickle Cell Action Network, because awareness without action has very little impact. We want this show to be a source of information and a call to action to help those who must live with sickle cell in their midst. We have designed the show to provide information that is beneficial to patients, caregivers, family members, and friends alike. Most importantly, we want people with sickle cell to know and understand that they are not alone. The Sickle Cell Action Network show features live guests who are healthcare providers, patients, advocates, and others who are engaged in the fight to eradicate sickle cell and ease its burden on those it affects. Today, we are honored to have very special guests to talk to us about sickle cell legislation. Joining me in studio today are Indiana State Representative Gregory and Carl Ellison, Vice President of the Indiana Minority Health Coalition. Also, potentially joining us by phone today will be United States Congressman Danny Davis. Congressman Davis represents Chicagoans in Illinois' 7th District. These gentlemen are all very dedicated to moving the needle forward on sickle cell disease legislation. We are delighted and honored to have them with us today. Before we get to today's topic, however, I want to share some of our upcoming topics with you so that you'll know what we're going to be up to. In future weeks, we will cover such topics as sickle cell advocacy, transitioning to adult sickle cell care, connecting the sickle cell community, the global state of sickle cell research updates, celebrity advocates for sickle cell, and so much more. So as you can see, we are very serious about putting it all out there, and we hope that you will join us every week, same time, same station. If you've missed some of our previous editions or wish that you could listen to them again, don't worry. Just go to the Martin Center Sickle Cell Initiative YouTube page and you'll find them there. Now let's get on with our show, and we'll start with this week's edition of Sickle Cell News Update. We do have several stories that we wanted to share today, and as always, every week we try to ensure people understand that there is a lot happening in the world of sickle cell. And the first story that I wanted to share with you comes from London, and it is about the opening of a new sickle cell center, the first ever, in a borough of London called Brent. And it's estimated that about 450 people live in Brent with sickle cell. And the complications resulting from sickle cell, as we all know, can be extremely serious. And finally, the community there has decided to provide a center for those people. And the community service that they are going to have is going to give advice and support to people with sickle cell and their loved ones so they can better manage the condition and make sure they only make a potentially stressful visit to the hospital if they really need to. The service is going to be run by the Brent Sickle Cell Society, and general practitioners can refer their clients to this center. And they say in this news release that in Britain there are between 12,500 and 15,000 people with sickle cell disorders, and that of course it is most common in people of African or Caribbean descent, but of course it also can occur in people from India, Pakistan, the Middle East, and Mediterranean areas. The Brent Sickle Cell Advice and Support Service was commissioned by the Brent Clinical Commissioning Group. So congratulations to Brent, United Kingdom, for bringing in a new center there. Another interesting story that I found is from Africa, and some of you may have heard about a drug called Nipricin, and apparently this drug does have good effects on sickle cell, but the government of Nigeria has outlawed the production and sale of Nipricin by commercial interest, and the government is going to take it over itself. And the reason they're doing this, according to this story, is that the commercial producers and distributors of Nipricin have been raising the price to the point where it's becoming unaffordable for those in Nigeria. They can't afford it, and so the government is stepping in and saying no longer will it be commercially available. If you want Nipricin, you're going to have to get it from a governmental entity. So that's an interesting development. Another story that we'd like to share with you is that here in the United States, the Children's Sickle Cell Fund has announced that the founder, Andrea Williams, is moving on to bigger opportunities. After establishing the Sickle Cell Foundation and leading the organization as the executive director for 13 years, Andrea Williams has been presented with an opportunity to make a different kind of impact for persons with sickle cell disease across the nation. She recently accepted the position as public health analyst in the hemoglobinopathies and newborn screening programs of the Health Resources and Services Administration, also known as HRSA, and her job there started November 1st, 2015. In her place as the new executive director at the Sickle Cell Foundation, and I believe this is in Philadelphia, the new executive director is Michael Matthews. So, interesting story there. And finally, our last story is we've talked about clinical trials here on the show on a number of occasions, and we're going to continue to talk about them. Sometimes the results are positive, and this time it's not. There is a clinical trial that's been concluded that shows that antiplatelets do not reduce vaso-occlusive events in sickle cell anemia. A total of 341 patients underwent randomization at 51 sites in 13 countries across the Americas, Europe, Asia, and Africa. The rate of vaso-occlusive crises, or basically the sickle cell crisis, events per person was 2.3 in the prasugrel group, and that's the name of the drug, prasugrel, and 2.7 in the placebo group. In other words, this drug did not do what they thought it would do, and that's unfortunate. This drug was being developed and funded by Daiichi Sankyo and Eli Lilly here in Indianapolis. That's our last story for today, and before we go to a quick break and then come back for the show, as always, we're going to take you through some sickle cell trivia. In the United States, a paper entitled Case of the Absence of the Spleen from the Southern Journal of Medical Pharmacology was probably the first ever in the United States to describe sickle cell disease. It discussed the case of a runaway slave who had been executed. His body was autopsied and found to have the strange phenomenon of a man having lived without a spleen. Although the slave's condition was typical, the doctor had no way of knowing this disease was caused by sickle cell, because sickle cell had not yet been discovered or identified. So today's trivia question is, in what year was the paper Case of the Absence of the Spleen published? Was it 1825, 1846, 1877, or 1910? And we will give you the answer when we come back.
Do you or does someone you know have sickle cell disease? Have you heard about the EPIC study? It's an international research study evaluating an investigational drug aimed at shortening the duration of painful crisis. And with over 50 sites in the U.S., there may be a site near you. To learn more and to find out if the EPIC study is right for you, visit www.theepicstudy.com.
Hi, I'm Gary A. Gibson, your host for the Sickle Cell Action Network Internet Radio Show. If you are impacted by sickle cell disease in any way, whether you are a patient, a caregiver, or a friend, you need to join me every Tuesday at 4 p.m. Eastern Time. I promise that you will find our show to be full of information, perspective, and opinion about all things sickle cell. See you Tuesday right here on RadioNext.tv
the Cool Groove site.
Welcome back to the Sickle Cell Action Network Internet Radio Show here on RadioNext.tv, the Cool Groove site. It is Tuesday, December 15th, and today our show is focusing on sickle cell legislation. And as I said in the introduction, we're honored to have two of our guests here today, Representative Gregory Porter and Mr. Carl Ellison, the Vice President of the Indiana Minority Health Coalition. In order to get us started, gentlemen, we usually like to, first of all, welcome you to the show. Welcome.
Pleasure. Thank you for having me.
Yeah, thank you very much. Glad to be here, too.
And we'd like to let our listeners get to know a little bit about you so that as we continue with the discussion, it makes sense to them why you're saying the things that you say. So the first thing I'd like to do is just ask each of you, if you would, to please tell us a little bit about yourself. You know, what is your current employment and how long have you been in that role? And why don't we start with you, Representative Porter?
All right. Thank you very much, Gary. It's a pleasure and honor to be here with you on this great day. Just a little bit about Greg Porter. Greg Porter is from Indianapolis. Been here all my life. Went to Shortridge High School, went off to Earlham College, came back home, started off my career as a community-based organizer, trying to change the world, and got that DNA in me at Earlham and continue to try to do it even today.
That's right.
Currently, I'm employed for Health and Hospital Corporation here in Marion County. Health and Hospital Corporation is the hospital. It's a corporation. It's a quasi-governmental agency with the city of Indianapolis. We are like the parent company to Eskenazi. So we help build Eskenazi Health. That was our baby. Along with the Marion County Public Health Department, Emergency Medical Services, Midtown Mental Health, and a couple other organizations, long-term health care. So those are things we do there. I'm vice president of external affairs at the corporation. I've been there for 15 years. I'm very blessed to also be a member of your Indiana General Assembly. Been there for started my 24th year about a week or two ago.
Oh, my.
Yes,
because
Gary,
I remember when you started.
I remember when you were at BMV, you know. So started that about 24 years ago now, Gary. And during that tenure, for the most part, for first 20 years, essentially served on the House Education Committee. Mm-hmm. And then went over upon Bill Crawford's retirement, went over and began to work on Ways and Means,
right,
the fiscal aspect.
Right.
So that's a little bit married, have 3 children, still live in the hood.
Okay.
So I'm excited to be here, and that's a little bit about GP.
We're very, very happy that you're here, and we're very, very happy for the work that you're doing today, yesterday, and the whole entire time that you've been involved with the legislature and working within our community to try to make things better for everybody. Mr. Ellison, Carl, please tell us a little bit about yourself. What's your current employment? How long have you been in that role?
Well, like Greg Porter, I'm not from Indianapolis. My roots are in South Bend, but I've been transplanted here in Indy for the last 10 to 15 years. I am the Vice President and Chief Operating Officer of the Indiana Minority Health Coalition, an organization that's about 20 years old and one that I actually helped found. I was one of the original incorporators about 20 years ago when we worked with the Black Legislative Caucus and Representative Bill Crawford to really put an imprint on minority health in this state. But insofar as Carl before IMHC, I am from South Bend, proud graduate of South Bend Central High School, and also a graduate of Notre Dame, where, Greg, you may not know, but Gary and I first met as Notre Dame students years ago, and both happen to live in Grace Hall. And so we go back to our 20s.
It's nothing like a domer.
Well, very, very true. So the domers sort of met in college, and now we work together on the back end here with Martin Center and on this very important public health issue. After college, by the way, I have a degree in English and Black Studies, so I know I'm trained and I know how to read and write very, very well.
Right.
But most of my career has been spent in government or in the nonprofit sector. So I started off as a housing coordinator with a Model Cities program in South Bend, Then I went on to run the community development program, the economic development director. Then I spent a couple of years at the Small Business Administration in Washington, D.C., running the minority small business side of SBA. Then I got recruited to go to Memorial Hospital, come back home in South Bend, and spent about 20 years as a hospital administrator. Then left and ran a network of community health centers in Ohio, and then came back to IMHC as a COO about 10 years ago. So most of my career has been in the helping people end of things, whether in government or in the nonprofit sector. I'm also blessed by virtue of my role at IMHC to be involved in other health and human service related activities. So I chair Covering Kids and Family of Indiana. Greg Porter sits on that board as a member. I also have spent about 8 years and then past chair of Indiana 211, another very important health and human service entity. And Gary, as you may know, I got to the Martin Center Sickle Cell Initiative to help at a time when we needed to help transform the agency to keep what Dr. Pierce and Father Martin and others really created many years ago, to keep it not just alive, but to have it refreshed. And I was blessed to be the chair when you were recruited, Gary, to be our executive director. And now, 4 to 5 years later, it's delightful to be here with Greg Porter to reminisce about the success of last year and also reflect on the work that still needs to be done.
And, Gary, if you remember, when we first hooked up, I also served on this Martin Center board for about 15 years.
That's correct.
So I guess the sickle, and I don't have it in my family, nor do I have it. But I understand about health. And health is important for all people. And as I crisscross the country, I see a greater need, and it kind of got dormant. Sickle cell,
right?
It kind of faded away,
right?
And now it's wonderful that people are beginning to pick it up again and advocate for against this horrible disease that affects a lot more people than what people think. And that's the whole point. It's the education part right now.
Well, part of the reason we're doing the show is what you just said. And the fact that, the disease didn't fade away, but talking about the disease faded away.
Yes.
And one of the best stories is that there was a time a few years ago when I was having my car serviced at a shop, and I was sitting in the room in the waiting area by myself, and in comes a probably 75-year-old African-American woman who's going to have her car serviced. She sits down and she seems very friendly, and we start talking. So she asked me, what is it you do for a living? And I said, well, I'm the president and CEO of Martin Center Sickle Cell Initiative. And she said, sickle cell, is that still around?
Wow.
And so that's one of the reasons that we're doing the show. We want people to know that sickle cell is still around. We also want people to know that there is action, and we're trying to ensure that people get to hear from gentlemen like you and others that we have on the show that are trying to do something to improve life for people with sickle cell. So we're very delighted that both of you, community activist-oriented, helping people-oriented people, have volunteered your time to be with us today. So, Representative Porter, you said that you've been in the legislature for 24 years, and that's a huge accomplishment, and certainly we thank you and commend you for that and your service. What other committees, you mentioned health, but what other committees have you served on?
During our tenure, we, of course, I said education committee as well as insurance, which goes back to health.
Yes.
Currently, the ranking minority member of Ways and Means.
Right.
And currently also serve on public health. Right. So what we've done is kind of stay within the realm of the health sector, so we can look at legislation that affects us, so we can navigate and do some more wraparound services for individuals. Served on courts and criminal code, served on judiciary, also during my tenure. So those are some of the committees we served on over the last 20-plus years.
Thank you. And Carl, you've been involved in legislative advocacy for a while. You've mentioned some of the roles that you've played. How long have you been doing this, and what kinds of issues have you worked on?
Well, Gary, that's a very interesting question. Remember, I'm trained in English. I know how to read and write. I have no formal government training, no training in politics. But my first job, as I mentioned, was in city government, in a model cities program. And so my experience in this area and interest in the area in part was cultivated by starting early on in local government. In fact, many years ago in South Bend, when I ran the community development programs, I would have to create local ordinances for the council to consider. And I would go down to the city clerk's office, and my wife Barbara happened to be a clerk there, so she would often file these ordinances for me. And then, of course, you had to go to the council, to the meeting, and would have to get to persuade the council to support whatever you put in place. So I learned the process of government policy making, government interaction, government communication early on, and really came to public health in a bigger way in the early 80s when my St. Joe County health officer, a guy named Dr. George Plain, a retired surgeon, said, "Carl, I need your help with minority health," because he had talked to Dr. Woody Myers about the notion of helping to create local minority health coalitions.
And Dr. Woody Myers was past health commissioner.
Correct. He was a past health commissioner in the mid-'80s, and so as a result of Dr. Plain getting me involved in the St. Joe County Minority Health Coalition, I was around in 1994 when IMHC formally incorporated as an entity. I was around in 90 and 91 when we worked with the Black Legislative Caucus to do town hall meetings around the state to gather input to put together what has become a hallmark piece of legislation that still exists, and that's called the Minority Health Initiative. Okay. Indiana is probably the first state, and there may be one other that's like it now, that actually in state law mandates the Department of Health work with the Indiana Minority Health Coalition to fund and support local minority health coalitions.
Right.
So our state, as a matter of policy, entrusts local citizens to be the leaders in identifying minority health issues and advocating, whether it's with the legislature or other policymakers like city council around, for example, anti-smoking ordinances. Our statute mandates that our local coalitions be funded and supported by the Department of Health to carry out really a citizen-driven approach to health improvement that makes us unique in the United States. And so I'm thrilled to have been a part of that for these past 20-plus years.
That's a lot. Again, thank you for your service to humanity. That's something that I think a lot of people don't do, is thank people like you enough for the work that you do. You know, Greg, you've been in the legislature for a while, like we said, and you've worked on these different committees. One of the questions I'd like to ask you, because I know the legislative process fairly well myself because of my experiences in the past, it's not easy to get legislation through, and we're going to get a little bit deeper into that as it relates particularly to sickle cell a little later on. But in general, are there any pieces of legislation that you've worked on that have actually become law? And if so, what role did you play in turning them into reality?
Well, there's several pieces of legislation, and most of them are done with education. Because remember, I was there for 20 years.
Longer.
And that's my expertise, and also I was a little public health. But standards and accountability in regards to education, which is Public Law 221 and Public Law 146, which now is evolved to do some other things. School discipline. We just did that this past year, reached across the aisle and behind with Representative Bob Boehning, which is very crucial in regards to me working in a bipartisan way, looking at school discipline and schools, to keep kids in schools, and looking at positive behavioral services for those students, and not put you out of school, but okay, how can we keep you in school? Because some of those kids want to be out of school.
Right.
And so then all of a sudden you have a low graduation rate, unemployments get high, you have other things happen, and so it's a spiral down to negativity. A couple of years ago, which was a big issue for us within the young people, was anti-bullying legislation. That was a coalition of about 35 community-based organizations that came together. As in kids, they said, "Are we getting bullied?" And we were like number 3 or 4 in the nation in regards to bullying and cyberbullying, and we got that through and got the governor to sign it. And I'm in the super minority, but we got that through. So it's about compromise, and a lot of things, Gary. When you working in General Assembly, you may have an idea, or someone may bring you an idea. Don't think that we sit back and say, "Oh, we're going to do this." No, people like you in the audience brings us legislation. Are there issues that affect your daily lives? From Minority Health Coalition to just things in general, looking at this disparities of individuals, and you bring that to us, to anyone, get it worked out, and you work through the process, and then you may not get it through the first time. It may take 3 or 4 years.
Right.
I'm working on a piece of legislation now. It's hate crimes and bias legislation. Been going on for 4 or 5 years, or probably more like 10 years. Bill Crawford started working on it also. It took us a long time to do the expungement. It took us 10 years to get the expungement legislation through, but we got through. And guess what? We're still tweaking it every year because we missed something, or it's not working out the way we wanted to work out. So which is huge, is the expungement for felons.
Right.
Because that means they get them back into life's circle of opportunity.
Right.
They're out of the game. We got to get them back into the game to be productive citizens. That's just some of the things, dropout prevention, things like that. That's just some of the things that we've done.
Yeah, by the way, Gary, I just said, my son, Greg, I don't know if you're aware of this, my son Marcus in South Bend works for Ivy Tech, and he conducts the expungement meetings that they have every now and again, and he's told me some real stories about people who benefited from expungement in terms of both access to employment, but really just the relief of having something off the record. And so that's an extraordinarily good program, and it would be very, very useful if more people were aware of the human side of expungement. That's really been extraordinarily beneficial.
And the human side is also looking at housing. Sometimes if you have a record, you can't even get housing, and you're able to pay. I mean, you're able to pay market rent or whatever, but guess what? You can't even get in to even pay the rent to live. So the quality of life is very important as we begin to move forward well into the 21st and a half century.
Right. All right. Well, I think one of the things I want to go back is we always try to highlight some of the messages that come through our discussion, and one of the highlights that just came from Representative Porter talking about the different pieces of legislation. Okay, Greg. One of the highlights that came from Greg's discussion is persistence. It's necessary to pass legislation. We'll be talking about that a little bit more when we come back.
Do you or does someone you know have sickle cell disease? Have you heard about the EPIC study? It's an international research study evaluating an investigational drug aimed at shortening the duration of painful crisis. And with over 50 sites in the U.S., there may be a site near you. To learn more and to find out if the EPIC study is right for you, visit www.theepicstudy.com.
Welcome back to the Sickle Cell Action Network here on RadioNext.tv. It's Tuesday, December 15th. We're talking with State Representative Gregory Porter and Carl Ellison, and our discussion today is about sickle cell legislation. So far, it's going really well, and we're really happy that these gentlemen are here. And we're going to continue our discussion right now. And I'm going to start by asking Representative Porter, or Greg, as he's insisting I call him. You've been involved with minority health for a long time. What would you say are the most difficult aspects of getting minority-related legislation passed?
One issue is when you serve in the General Assembly and you have 150 members, and of the 150 members you might have 12 that are African American,
right?
And you have 92 counties, and of the 92 counties, 72 are rural. It's an education process, and they think, my colleagues feel, it is only a Gary, Indiana, or Indianapolis issue. Now, that's not only with minority health, that's in all aspects of our great state. And it's nothing that you want to, isn't really denigrating to them, but it's a lack of knowledge. But you also have to understand that legislators are peculiar animals. I'm part of that fraternity, sorority, or whatever you want to call it. Unless it affects someone who they know or someone who they are engaged with and informs them of an issue that affecting them, Gary, it's not on their radar screen. They know of it, but they don't necessarily embrace it.
Right. So we just have to find ways to help them embrace it.
Right.
Carl, what's your perspective on that question?
I think Greg hit it on the head. I mean, at the beginning and at the end, all politics are local, but there are some issues that are generalizable to the whole population. And my experience is that particularly minority health has always had bipartisan support in this state. It's something we've been able to advance because of the willingness of, frankly, Republicans, Democrats, Independents, whatever, to see common good. Now, I would say the number one barrier challenge with minority health is data. Getting good data to help describe the problem, describe the disparity, whatever it may be, is challenging because we don't have a practice or we don't have a history of collecting race, ethnic specific data. I mean, the example would be infant mortality is now the highest priority of the governor and the Department of Health. And when I go back to my 20 years or so ago and really getting interested in black infant mortality, and by definition infant mortality in general, we still had State Department of Health data which described the problem in black, white, or black, non-white terms. We really didn't have good data for Latinos, let alone other subgroups which are now among the population, like the Ming or others. So we don't have a 40-year trajectory where we can show by county or even by city how many black babies died versus white babies and what the rates were over time, because we didn't have a systematic way of collecting the data, and again, we often had data as white, non-white. Yeah. And so we've gotten better over time with respect to data improvement, but even for sickle cell today, if I said, Gary Gibson, how many people in the state have sickle cell now, and what's the number of people who have a prevalence for it? You can give me estimates.
That's all I can do is give you
estimates. But you can't give me a demographically done, scientifically appropriate data to give us a more precise estimate. Well, it's hard to go then to Greg and other people on Ways and Means and say, we need more money for this disease if I can't illustrate in statistical terms what the extent of the need is and then what the resource requirement is going to be to address that need in such a way that you improve the health of that population and by inference the health of the state overall. So data is always a challenge for health disparities.
I know, Greg, you want to say something, but let me add, this is one of the things that we're attacking right now with our Get Connected project that we're working on with the Sickle Cell Disease Association of America. And in that project, it's all about trying to identify the number of people that have sickle cell disease within our area. So we're reaching out from Martin Center Sickle Cell Initiative to our own client base as well as to others that we don't know to try to find them and try to get them connected. And that is the way to build the new national registry for sickle cell disease that's taking place, all for the purposes of what you said, trying to get data.
Right.
Representative Porter?
Yeah. Well, and Carl hit on it. We look at the outcomes. And let me break it down a little more. I'm a legislator. I run every 2 years. So when you look at longitudinal studies, I care, but I don't. Because longitudinal studies are 3, 5, 7 years. I don't have 3, 5, 7 years. I have about 18 months, and I'm looking at legislation. The senators have 4 years,
right.
So they're looking at 36 months, and then they look at issues, and then they're running.
Right.
So when you talk about longitudinal studies or looking at the disparity, or like you said, look at the subgroups and drilling down, some of us, our clocks are not like your clock.
Right.
Our clock it's an 18-month clock versus a 60-month clock. Okay, and so from that standpoint, you got to say this is where we are. These are the potential trend. Now let's look at this. Anything we do in Indiana, Indiana is not that much cutting edge. I tell people when I crisscross the United States and internationally, I said we're not slow. We're just thorough. Okay. And we just look at things a little more differently, all right? And we're just a thorough state. And so what you do, you build on what's already out there, model legislation, model statistics, and you drill down like God rest his soul, like Amos Brown did. And he was a statistical genius. Amen. He had one of the keenest, most analytical minds I ever encountered. But he was taking statistics and move them and say, this is what potential outcomes are.
Right.
So that's what we have to do.
That's exactly what we have to do. I think another area that is involved, and I maybe want you guys to chime in on this, is Frederick Douglass said, power concedes nothing without a demand. And where I'm going with this is that people have to come forward and people have to say, we need this. And if people don't do that, then it's probably going to continue where the majority of those in the legislature think it's not an issue because nobody's made it an issue to them. Would you agree that having the minority community step up about minority health issues, coming forward with protests or demonstrations and things like that would help the process in some regard?
Absolutely, Gary. But I've been on National Task Force for 3 years now. By 2030, 2035, the minority are going to be the majority.
That's right.
And so when you talk about the minority, we can't wait 25 years, but those individuals look at the outcomes. But one other thing they look at is economics. What is the fiscal impact of not addressing this issue?
Right.
How is it going to hit the bottom line of the state's budget or the national budget? And once you drill down and you look at the fiscal impact of it, then they begin to change their tune. So, but the minority communities just have to say, this is where we are, and go with it, because it's the fastest growing population.
Right. So Greg is just essentially articulating the language of advocacy.
Right.
And, unless you can see it and describe it and educate what it is you want as the outcome, you probably can't have it. And we've been blessed, whether it's Greg Porter, Bill Crawford, Charlie Brown, on the Black Caucus side, the Pat Millers, and others on the majority on the Republican side. We've been blessed to have public health leaders who at least are willing to listen.
Right.
And we've been blessed to have some pretty good health officers like Dr. Jerome Adams now. What I like about Dr. Adams most of all, he's a good listener.
And he's the current state health commissioner.
But he knows how to listen. He knows how to apply what you told him to help you achieve your goal. In fact, as we talk later about what happened in the last session, but for Greg Porter, but for Dr. Jerome Adams, and but for other leaders, we would not have achieved the outcome we did. And so we've always been blessed to have advocates. We really have. And we've lost some big advocates, whether it's Bill Mays or Bill Crawford. We've got some mighty, mighty big shoes. Amos Brown. We've got some big shoes for others to fill. But generally speaking, over time, somebody will be the advocate, somebody will rise and will rally the village, and when necessary, we will, I won't say show out, but we will make sure that the policy people hear our concerns and are willing to address them, because as a rule, in my experience, we don't ask for anything that isn't good for everybody.
Right.
Minority health, IMHC has said over the years that minority health is everybody's business, and the reason for that is that indeed, if you improve the health of minority populations, you improve the health of the nation.
Very well said. Ladies and gentlemen, you're listening to the Sickle Cell Action Network here on RadioNext.tv. We're talking about sickle cell legislation with State Representative Gregory Porter and Mr. Carl Ellison. We're going to take a break, and then when we come back, we'll continue this great discussion.
Hi, I'm Gary A. Gibson, your host for the Sickle Cell Action Network Internet Radio Show. If you are impacted by sickle cell disease in any way, whether you are a patient, a caregiver, or a friend, you need to join me every Tuesday at 4 p.m. Eastern Time. I promise that you will find our show to be full of information, perspective, and opinion about all things sickle cell. See you Tuesday right here on RadioNext.tv, the Cool Groove site.
To find out if the EPIC study is right for you, visit www.theepicstudy.com.
Welcome back to the Sickle Cell Action Network. We are speaking with Gregory Porter, State Representative, and Carl Ellison, Vice President of the Indiana Minority Health Coalition. We certainly want you to join us in thanking our sponsor, Mast Therapeutics. The Sickle Cell Action Network show is sponsored by Mast Therapeutics, a publicly traded biopharmaceutical company headquartered in San Diego, California. MAST is currently leveraging the molecular adhesion and sealant technology platform derived from over 2 decades of clinical, non-clinical, and manufacturing experience with purified and non-purified polaxamers. MAST has developed a drug called MST-188 as a candidate for serious or life-threatening diseases with significant unmet needs. Among those needs is the treatment of sickle cell disease. MAST is currently enrolling sickle cell patients in a clinical trial known as EPIC. EPIC stands for Evaluation of Purified Polaxamer in Crisis. If successful, EPIC could result in the first treatment of its kind to treat sickle cell disease patients while they are in crisis. The EPIC study aims to determine whether MST-188 can shorten the duration of a painful crisis. MST-188 is an investigational drug that has not been approved for commercial sale in any jurisdiction or for any use. MST-188 potentially improves oxygen delivery and may help keep blood vessels from becoming blocked, more obstructed. It also may improve blood flow by stopping cells from grouping together. It may reduce inflammation, and it may restore cell membranes and give damaged cells time to heal. Interested patients should know that EPIC participants will continue to receive their normal pain treatments during crisis, and that there is no cost to participate. Interested patients should also know that participating in this study could not only help themselves, but might also help future generations of those yet to be born. If you are interested in learning more about the EPIC study, please visit www.theepicstudy.com. Thank you again to MAST Therapeutics. We are talking with Representative Porter and Mr. Ellison about sickle cell and legislation, and I'm going to continue our discussion now, and we're going to say to Representative Porter, I keep doing that, I'm sorry, Greg, you want me to call you Greg, but I have so much respect for you, it's hard for me to do that, so hopefully you understand. You've served as the ranking member on the House Ways and Means Committee for a few years now. Would you take a moment to explain to our audience, explain that committee to them, and let them know why this committee is so important?
Thanks, Gary. I'll be very brief because you can get into a lot of details about Ways and Means. Ways and Means is the money committee. That's the bottom line. We help set the state budget. There's about 30 people on that committee. The governors may come up with a budget. We look at that budget. Committees are various organizations throughout the state of Indiana. Departments come up with their budget. They make budget presentations, why they need what they need in regards to their budget. And we make a decision on if we're going to give them what they ask for, from Family and Social Services to the judges. To several universities, IU, Purdue, and the 3 or 4 universities that are we fund on a biannual basis, and we're the ones that help make up the $31.5 billion budget over a 2-year period. Mm-hmm. So we set the tone. We are the ones that say, here's the money, and thou shalt spend the money this way. Mm-hmm. Mm-hmm.
So, from Carl, I'm going to go to you now. From your perspective as a leading minority health advocate, what are the top 2 or 3 legislative obstacles that impact progress on issues about minority health? We sort of touched on that, but I don't think we covered it all.
Well, we didn't cover it all. I mean, we talked about data, needing more of it, better of it. I would say just time to educate, and build relationships. It's helpful to already have a relationship with a policymaker before going in and asking something. So over the years at IMHC, we've been blessed with our infrastructure to have, if you will, a lot of folk who help us do engagement on a consistent basis. We have Tony Gillespie, who does it on a spectacular, outstanding way.
Yeah, he's great.
For IMHC,
he's great.
And he sort of worked with other folks who are like him. We've had the same lobbyist, Charlie Hiltunen, Third House Advocacy, with us for over the years. We also, in the last session, introduced the notion of actually having legislative interns or public health interns who help in the process, are part of the presence at the State House, etc. So while I'm articulating sort of how you overcome a barrier, the point is that one of the obstacles to moving the public policy needle is beyond a good issue and beyond good data is relationships. And I would say everything else is secondary to those two things.
Okay. Greg, would you agree to that?
Absolutely. We can come up with all the information in the world, but if you don't have a relationship, sometimes it just won't go as far as you may want to go. For example, in the piece of legislation we had introduced last year had Representative Clear, who's former chair of the Public Health Committee, Representative Charlie Brown, who's a former chair of the Health Committee, and a gentleman by the name of Representative Frizzell. Two Democrats, two Republicans, four individuals that respect each other and said, come on, we're going to do this together. And that's a relationship. And they're not freshman legislators, they're seasoned, so they have a following. So when you have individuals that you come together and you want to move something forward, the needle, as Carl said, it's good to have a variety of individuals and individuals that are respected by both caucuses. And it takes a while for that to happen. You just don't come in and say, okay, we're going to follow you, or we going to open up our process to you. You got to earn that trust, and that's important.
It absolutely is. And let me just add or amplify further what Greg is saying, and particularly just to focus on one of his colleagues, Representative Ed Clear. The IMET relationship with Representative Clear goes back to his willingness to go with us around the state. A lot of car rides over 18 months where we did town halls on the Affordable Care Act. And so you had this traveling road show that often was Ed Clear. Then you'd have Charlie Brown join when he could. We had Paul Chase, who passed away, but Paul Chase, then the deputy at Covering Kids and Families of Indiana, was also on those road trips. And I'd say over a series of months, when you're riding with somebody for 3 or 4 hours and you're getting a chance to chit-chat and you're breaking bread after you've done a town hall after town hall after town hall, at IMEC we were just impressed by Representative Clear's dedication, his willingness to be on the road, his willingness to help us urgently talk about the fate of the uninsured and the need for both the Affordable Care Act and ultimately for the Medicaid expansion the state did. But we built a relationship on one issue that then when we needed his help on the sickle cell issue, I think helped, along with Representative Porter, us get through the hurdles I'm sure we're going to talk about that are really reflective of the success you need to have building relationships before you really have to want to ask for something.
For those listening so far, we've got 3 key words that have come out of our discussion as it relates to sickle cell legislation. One of them is persistence, another is data, and now relationships. And absolutely, each of those are critically important. According to my research, only 18 of our 50 states, including Indiana, have some kind of sickle cell laws on the books. Is that a statistic that surprises either of you? And if so, why? And if so, why not? Representative Porter?
That doesn't surprise me, because to a lot of individuals, it's another unknown, and it does not affect their community. You have to remember how many majority community versus minority community currently, and they're still living and making some decisions from the 19th century, not necessarily the 21st and a half century on where we are. Matter of fact, I give them the 20th century now. But I mean, even from that perspective, we just had a national conference. National Black Caucus of State Legislators had their conference in Los Angeles, and we had some issues that come with legislation. Look at some model legislation. I think it was out of South Carolina. So it's beginning to bring up momentum in regards to having it out there and people discussing it. And it probably comes from Congressman Davis also in his work over in Illinois.
And Carl, I mean, your perspective on this, is it the same as Greg's, or do you have a different take on it?
Well, I was actually surprised there were 18 because I do think
that's more than you thought?
Yeah, because sickle cell has been pretty silent as a national issue. We've not had the leadership from Congress to address this on a national basis. You know, it's interesting that our national health goals essentially call in the end for health parity. But when you look at our national health spending, our national health priorities, sickle cell doesn't rise to the top. And so it's kind of one of those things where you got to continue to beat the drum to get everybody's attention. But clearly, if Congress were to take a bigger role in providing leadership along sickle cell, I think most of the states would follow suit. And so 18 is great. I thought it would be more like less than 10.
Well, what's really interesting, and I've given each of our panelists a list of those states and what the programs they have are. Most of those 18 really are not about providing services. They're more about providing information, education, and that kind of thing. So we've got a long way to go. I think when you look at that list and see where Indiana stands at this point, you know, Indiana rises up to the top in terms of what it's doing at this point in terms of providing services, and a lot of that has to do with the work that you have done, Greg.
Well, Gary, I just want to pause. Let me wind the clock back 20 years ago, and Representative Charlie Brown, who's been a long-standing member of Public Health, ranking minority now, former chair, I remember that Charlie was involved in getting the sickle cell appropriation had been in the state budget for some time.
The original.
My memory is that it went up to $300,000. I can't remember what it was before that.
It was $200,000.
It was $200,000, and that was what, probably 22 years ago. 20 years ago.
Yeah.
All right, and so that time, the leadership that Representative Charlie Brown showed then to get sickle cell to double in funding is reflective of the fact that at least it was on the radar in Indiana.
Right.
And so it's not surprising that we would perhaps outperform other states in this regard.
Right.
And I don't know whether that was just something Charlie did. I do know that in this state, the Black Caucus helped to create what's called an Interagency Council on Black and Minority Health. This goes back to 1991. And there was a 5-year really strategic plan on minority health that came out of the work which led to the statutory enactment of the Interagency Council, which still exists today. But the plan enumerated a number of conditions that entity was to focus on, one of which was sickle cell. So in our state, we strategically recognized this as early as 91 and perhaps earlier, because I don't remember how long we've had a sickle cell statute.
Since around the 70s.
Around the 70s, okay.
Yeah, so.
All right, then so we're a pioneering state in that regard.
Yes, yes. Okay, great. That's good. So, Greg, in Indiana's 2015 legislative session, you introduced House Bill 1329, and that really was the first legislation since that time around the 70s. So it was historic from that standpoint. And it was a bill that called for the expansion of sickle cell services in the state. Everyone impacted by sickle cell in Indiana is definitely grateful for your efforts. And I just would like, if you would you tell us a little bit about why you filed that bill?
Well, Gary, the reason why I filed that bill because you came to my office and you made a big plea.
That's not the answer I was looking for.
Okay. I mean, it's the truth. Now, you've been around me long enough to know. And sincerely, Gary did come to the office, but I served on the board for about 12 to 15 years, so I understood it. And I looked at the budget, and we wanted to address the health disparities. And sickle cell is something that we wanted to address in regards to our community. And Gary and I had talked about it. Matter of fact, we worked on it for 2 years.
Correct.
First year, nothing happened with it. And then last year we filed a bill to move it forward. And it got out of committee with Carl and Gary and about another 40 other individuals who came down and spoke in regards to the bill and talked about why it was important. And it came out of committee with now a descending vote.
It was unanimous.
It was a unanimous vote. And then it got recommitted to Ways and Means because they had a little fiscal on it. And then,
in other words, it costs some money.
It cost some money, and then after that, it did not get a hearing. And to be quite honest, I erupted, and I'm put in a nice way.
Yes, you did.
And but in the end, after my eruption, and we were going to expose some individuals, because I just made a comment that just because I said, if you are a physician in life and you don't think this is important, what kind of oath did you take? And from that standpoint, we were able to get some money in there in the budget.
Now, Greg, if I might, Greg, you got the Cliff Notes version from Greg Porter. Now, let me give you the Carl Ellison version, which just has a little more meat on the bone.
I was about to ask for the Carl Ellison
so the listening
version.
public can understand the very dynamic, often unscripted process,
it's a process
of legislation.
Right.
In that, yes, this was the second time around, and a framework was provided essentially to expand sickle cell funding, because it's great to have Martin Center in Indianapolis, and it's nice to have a little bit of effort in South Bend, but we don't have sickle cell presence in terms of education and other services in Gary, in Fort Wayne, in Evansville, Jeffersonville, other parts of the state where we know there's need.
Right.
And where historically there actually had been sickle cell centers that were supported by the state years ago. So this bill was about reconnecting, re-putting in place a network, increasing funding for the first time in 20 years to a level more appropriate, and really allow us to do more wraparound services for these families who we know are high need. And so we were blessed in a couple of regards. Greg filed the bill, and again, Representative Ed Clear is the chair of Public Health. Remember, Gary, we took him to dinner.
We
remember,
went
we
to
sat
dinner.
down.
This was about relationships
and it was
again.
relationship, but it was about a lot of education,
Yes, it
because
was.
Ed asked us a lot of very precise questions
Right.
about the impact on families, about the scope of the need, about what the history of funding had been. He asked a lot of questions. He was not just I'll be all for you. Even though we had a relationship with him, we still had to convince him
yes.
that this was important. And so we left that dinner where our aim, Greg, was just say, would you please get this bill a hearing? That's what we wanted the chair to do.
Right.
And lo and behold, he gave us a hearing.
We did have to ask several times.
We may have, but we got a hearing. We got it in a relatively short period of time. But what was more extraordinary, and what I always will be grateful to Ed for, and to you, Greg, is that we got a hearing that lasted more than an hour. We had enough time to bring at least 10 people who testified, so the legislators there got to hear the real story of sickle cell from the people. And it is extraordinary that they heard the story, and that House Public Health in a Republican-dominated legislature passed the bill unanimously. That is extraordinarily rare.
Not only was that true, but we also noted that others signed on to the bill as co-sponsors after the hearing. Right. So that was very moving.
Correct. So the bill had extraordinary momentum, and it was sort of the aggregation of things which happened, and frankly, having a member of Ways and Means be the sponsor of the bill, and being part of Public Health, and being Greg Porter, was also extraordinarily important. But again, notice Porter, Claire, bipartisan to start.
Yes.
And so we were then stunned that the unanimous recommendation coming out of Public Health was not granted a hearing for Ways and Means as part of the process because of the fiscal. We were stunned by that, and thank God that Greg Porter erupted, and we were able to get beyond that obstacle. I mean, I'd add one other piece to all of this, and that is that we also had great support from Dr. Jerome Adams. I mean, I think Dr. Adams said his greatest strength is that he listens. Right. And we had to go to Dr. Adams and also help him understand this issue, see the issue, understand that we really were trying to expand the footprint statewide, provide more wraparound services for the family, which required more money. And I must say, Dr. Adams, to his great credit, worked in the background. He worked this bill as good as a state health commissioner I've ever seen work a bill, and made this an important priority for his Department of Health and for the state. And we just happen to be blessed to have these assets there at this point in time. Right. Where, but for the assets being there, no matter how good the argument, we may not have prevailed.
And Carl and Gary talking about the testing part of it. They were saying, well, we do test children for sickle cell at birth, but the money came from somewhere else,
Right.
and which you guys unpacked it very carefully, and it wasn't. It was taking the money that should have gone to services gone to Martin Center, taking that to do the testing when the dollars for testing was already there, but they diverted the dollars. But Dr. Adams really didn't understand that, and once he got a hold of that, he began to unpack that to let them know what was going on. And the bottom line, the bill didn't move forward, but we got an extra. I think we had $190,000 a year in the budget. Now the budget is $490,000 per year.
So it's a major improvement.
It's a major improvement.
Major accomplishment.
Absolutely. I mean, and you know, you think in a state budget is billions. It's not a lot of money.
No, it's dust. It's dust.
Right, but for those out here on the front line trying to address this issue and others, that was a significant policy statement on behalf of the state to give us an opportunity to really do what we said we're going to do. Now, bear in mind, for the listening audience, we asked for more than we got.
Yes.
So this is not the end of the story. We're going to continue to advocate till we are able to better address this issue around the state. But thanks to Representative Porter, Representative Clear, Dr. Adams, everybody involved in the process, we got a major victory in the last session. And it's great that we've had this progress after 20 years. Let's hope we don't have to wait 20 more years to get more, perhaps in the next session, not the next coming up session, but the next biennium session where we're doing the budget in 2 years.
Thank you both. That's a great recap, and I too would like to add my commendations to Representative Clear. It was a wonderful dinner that, Carl, we thought it might last an hour. It ended up lasting 2 because of his involvement in the questions, and he really got into it. He asked a lot of questions, as you said. They were very good questions, and the more he heard, it seemed like the more it made sense to him that we needed to do something. So that's how we got the hearing. We're going to step away and take a break, and then we're going to continue our discussion with Carl and Greg, and we're going to shift focus a little bit, but it's still about sickle cell legislation, so stay with us. We'll be back shortly. Welcome back to the Sickle Cell Action Network Internet radio show on RadioNext.tv. My name is Gary Gibson, and I am the host of the show. And the show is brought to you by Martin Center Sickle Cell Initiative. We are a 46-year-old community-based organization providing services and education to our community, services and education related to sickle cell disease. We are the only agency of our kind in the entire state. We provide services that include a support group, a food pantry, transportation assistance to help our patients get back and forth to their doctor's appointments. We have emergency financial assistance. We provide general referrals and counseling, among other things. And in addition to that, we go out into the community and provide sickle cell awareness and education at numerous health fairs every year. And we also spend a lot of our efforts on advocacy, and sort of what we're doing with our show is advocating for more action and more support for people that have sickle cell disease, and that's why we launched the Sickle Cell Action Network. Again, joining me today are Representative Gregory Porter and Carl Ellison, and we're talking about sickle cell legislation, and I would like to ask my guests that, since we are talking about sickle cell legislation today, we're doing that because we want our listeners to understand that working with their legislators is an important, necessary step to making progress. So I would like each of you to give our listeners some insight into the best ways to get started on adding or enhancing sickle cell legislation in their states. As we said, only about 18 of the 50 states have some sort of legislation. So, Carl, what advice would you give for those that are listening? I know, and I'm going to let you answer, but I know I have received phone calls from people in other states like Iowa that say, we don't have anything here. How did you do what you do? How can you do what you do? What do you say to people like that might be listening in Iowa or some other state that doesn't have sickle cell legislation? How should they get started?
Well, it's probably like has happened in minority health. I mean, IMHC is kind of unique in the United States And you'd be amazed how many states have called us over 20 years wondering how our model happened. How did you get a state statute passed? How did you have this network of local coalitions? How do you support them? What's the relationship with one another? So typically, I would expect that as sickle cell raises in profile nationally, the Martin Center Sickle Cell Initiative will get more phone calls from other states asking about how did you go about getting the level of support you have, and frankly looking for models. I think as Greg Porter indicated, whether it's legislation or programming, models are great. It's also, you remember there's the National Sickle Cell Association to hope that association can prompt growth in other states. But I do think in the end, in terms of more national presence, we need Congress. Congress needs to have this higher on their radar. We need Danny Davis's bill put in law. We need Congressman Carson and, frankly, the whole Indiana delegation to get behind this issue. Because, again, the context of minority health in the United States is that our national health goals commit us to equality of health outcomes.
Right.
Now, it's suggested we're going to do it sequentially, but in the end, as a nation, we have said in our health goals that we want equality of health outcomes, and therefore, if there is a disparity that's existing, and certainly sickle cell would be one would think that we'd have national leadership to address that. So my hope is that we'll have a better context to get more states involved. But in reality, local folk can call Martin Center and they can create or have an organization that exists, add this to this portfolio, get some assistance from Martin Center, like Martin Center years ago got it from the University of Cincinnati. Cincinnati has very, very successful sickle cell program for some time. And frankly, Martin Center itself helped to nurture sickle cell initiatives in South Bend, Gary, and other places years ago. And so sickle cell's kind of been a each one teach one kind of phenomena, but still having the context of government support and government saying this is important is very helpful to stimulate local effort to then create more BGS out there to address this issue that affects so many people.
Greg, do you have anything you'd like to add on that?
Yeah, I would. Just very briefly, Gary. It's a grassroots movement. You know, Carl talked about Congress. I mean, and Congress is great, but you know how everybody feels about Congress. They don't get anything done. Okay, so we can come out and we can have those initiatives at the congressional level, but like Danny's bill was there, Congressman's bill was there, and
we're going to talk about that.
You know, it just won't get any legs. And when you talk to Congress people at the congressional level, as U.S. senators, and being a black legislator or being a legislator, they always tell you, you guys are the pulse of the community. All politics is local. As you go, as Congress goes. Okay? So, well, if that's the case, well, let us go. Mm-hmm. And you do as we want you to do. Mm-hmm. And you might have some significant outcomes. Mm-hmm. So, what you're doing with here in Indianapolis is pivotal, but it can move to other places, like you say, Iowa. And if you go back, it only takes a few. And the bottom line is that those individuals that have to live it, they're the best advocates. And so,
right.
and you have to, and they have to come and tell us and say, this is what's going on. When I say you had 40 or 50 people at a public hearing, that was very compelling. When we did anti-bullying legislation, and the kids that were bullied and the kids that knew someone who committed suicide because they were bullied, that's compelling. And that's what policymakers are. We look at things and see what happened and what directly affects those individuals. So that's what we do as policymakers.
Thank you. In our November 17th show, we focused on how sickle cell is treated unequally by society in a number of ways. We talked about how it's underfunded and underrepresented in comparison to other diseases that affect fewer people. Some of the other diseases that we mentioned were cystic fibrosis, hemophilia, and ALS. From your perspectives, why do you think that this is, and what do you think can be done about it? Carl, why don't you take this one first?
Well, I think those other diseases have a bigger brand, even though they may affect fewer people. So some of it is that sickle cell has not enjoyed the same level of notoriety as the other conditions. And okay, if that's a given, then the challenge is obviously to raise his profile.
Right.
Yeah, you've got to raise his profile because, again, it's because it's a disease that, relatively speaking, affects so few. It's harder to make it an issue that every policymaker is going to grapple onto. Because back to what Greg said, if you're a policymaker, the question is, does this affect my constituent? Does this impact my community? Are people in my community come to me and says, yep, need to do something about this? And by and large, for sickle cell, the answer is no. So that doesn't excuse, though, the advocates from nonetheless doing what advocates do. And as
you still have to
advocate. You got to educate. You got to advocate. You got to educate. Right. Again, I think the example of what Greg Porter and the legislature did in the last session demonstrates that, despite the fact that it may be a condition that doesn't affect a lot, doesn't affect millions of people, nonetheless, it's an important enough public health issue that it can actually get you some support, but you got to be willing to work for it.
What's interesting about this, too, is that if you look at the estimated population of people with sickle cell in our state, in Indiana, which they say it's somewhere around 1,300 maybe max. We don't know if that's a real number or not. The program that I mentioned, Get Connected, can help us maybe find that out. But we actually have fewer people in this state than they do in the city of Atlanta. The city of Atlanta has close to 3 times as many people with sickle cell, if not more, just in the city of Atlanta.
Well, but was it 1,600, 1,500, whatever number out of 6,300,000 Hoosiers? It's a very, very small end, and therein lies the rub.
That's right. So anyway, and you're right. It's not on. They have no.
But but I'm looking at the sheet you gave us.
Right.
And of the 18 states, the state of Georgia
is not listed.
It's not listed.
That's correct.
Yeah.
That's incredible,
isn't it?
No. But it's silent to policymakers, and of all states where you think there'd be civic advocates for whatever there is, Georgia.
There's CDC, a tremendous amount of advocacy in Georgia.
The CDC is there, no less.
There's a tremendous amount of treatment there. They have one of the highest rated health hospitals for sickle cell called Gregory Health, and all of that. But there's no law backing all of that up that we could find in our research. Interesting.
And I know the CFO of Grady.
Is that right?
Really? Okay. So
He's
another question I wanted to ask you before we start wrapping up, because I always hate it when we get to this part of the show because we're not done yet, and there's more things we could talk about. But we have kind of touched on Representative Danny Davis, who we had extended an invitation for Representative Davis to call in, and we thought that he might, but apparently he's extremely busy today. He filed House Resolution 1807 on April 15th of this year. 2 days later, that resolution was referred to the House Subcommittee on Health, and nothing has happened since then. And this is actually the same thing that happened when Representative Davis filed House Resolution 2518 in July of 2011. That resolution also went into committee and never came out. And Greg, you sort of touched on it, but in your opinions, what's up with this? Let me add to the fact that on House Resolution 1807, there are currently only 13 co-sponsors, and when you see a lot of these resolutions, particularly maybe even resolutions more than bills, you'll see lots and lots and lots of co-sponsors. What's up with this? Why can't we get Representative Davis's bill to get a hearing like we were able to do with our bill here in Indiana?
It's Congress, but it goes back to this 18 states. And you said how many co-signed?
13.
13. They just don't understand, and they don't understand the economic impact. If you come back and you talk about what is the fiscal impact of sickle cell or sickle cell trait, the disease, and how it affects certain communities, I can explode your state budget, okay, or throw a bunch of people into bankruptcy. Then you people pay attention. And right now, they're slow to move. That needle to understand what sickle cell is slow to move. I mean, Gary, you heard me tell the story before. 50 years ago, or so, 45 years ago, I'm in 4th grade. Everyone in my school took a sickle cell test to see if you had sickle cell or you had the trait. Now, that's back in the 60s, but then it faded away because at that time people understood what it meant. It was just like polio or anything like that. And unfortunately, it didn't go away as we talked about, but it fell off the radar. The dialogue died, and now we got to get the dialogue going again, right? Because people are passing away every day from sickle cell. We just, and as I say, National Black Caucus State Legislators, we had an issue. We did some resolutions, and we just talked about sickle cell model legislation in I think South Carolina. So the discussions are there, and then people start saying, "What's going on?" So now we're going to wind up. We had a pre-conference talking about sickle cell. And now I guarantee you, next year, with whoever company, Lilly or whomever, we're going to have a workshop or a symposium on sickle cell. But we tried to do it when I was on the board here about 8 years ago. We tried to do it also, and it just never got legs and walked. But it's beginning to resonate again because of the fiscal impact.
Right, and that fiscal impact is huge. And, you know, in one of the papers that I've written, I do share that information. There's not many studies, but there's been a few studies that show that, you know, for instance, close to 70% of the patients with sickle cell disease are on Medicaid, and that has a huge impact on the state budget. It has a huge impact on the federal budget, and it may cost as much as $13,000 a year more for a child with sickle cell with health care costs than it does for a child without sickle cell. So those fiscal impact, that's extremely important, and there is limited data out there, but maybe we do need to start using that more in our advocacy, and I know that we certainly will. So another question, and we're probably close to the end now, but what about at the local level? What can people do to ensure that their local health departments pay attention to sickle cell? Greg?
Call, go to the meetings, just talk to the local health officer, and just and go in and just say, I'd like to have a meeting on sickle cell. I mean, it's just because what you got to do, one has to do is go educate. This is about education. People may think they know, but the bottom line is that you get individuals, and you know what? It doesn't have to be 100 people. You only take 5 or 6 people like to talk about sickle cell and what's going on in our community. And I'm here as a resource, and don't become combative. Say, we're here as a resource to help, because this is coming down through the pipe, and we want you to be aware of the situation and let you be prepared to address it. Okay. And move it forward in a positive way. Not shaking your finger saying why you're not doing anything about it, but this is what we can do together. Yeah, because it does impact.
Can you help us figure this out? Yes. Can you help us resolve this? Yes. Carl, do you have anything you want to add on?
Yeah, I mean, ultimately it's a leadership issue, and we don't have enough sickle cell advocates around the state who are articulate on the issue, understand it. Which is why, Gary, I think probably Martin Center has to look at having statewide sickle cell presence, providing leadership with folks in Fort Wayne or Gary or whatever, to have conversations with their health officer. Certainly Dr. Adams, Jerome Adams, has been an advocate, could help out. Yeah. But ultimately it's about leadership. And I don't see another entity like Martin Center out there elsewhere around the state. There isn't one. So I just think at the board level we have to talk about, can Martin Center take on the stewardship of this issue on a statewide basis. To me, that would seem to be logical, but it means the investment of time and energy beyond our own organization for the good of the state. And I think if we did that in partnership with organizations like ours, the Indiana Minority Health Coalition, the Indiana State Department of Health, I bet we could put together a consortium of entities who would have an interest in this, who can make the conversation more systematic, more directive, et cetera. And I think Greg would attest that if we're doing that and then we come back to the legislation about, okay, what's happened so far, we're better off to demonstrate that not only did we take some money to expand wraparound services, but we're also taking a leadership role to help refine the number of people who are affected, and to cultivate other leaders in other parts of the state who ultimately have the ability to expand the footprint statewide.
They're about outcomes. These are our outcomes, and this is what we've done with this. If we have more, we can do this.
Very good.
The beat goes on.
It does, and it will continue. This is an issue that is very, very dear to our hearts. As I said, Martin Center Sickle Cell Initiative has been in existence and serving people with sickle cell for 46 years. It is our DNA, and we care so deeply about those that we serve, and we are doing everything that we can to change things for the better. The problem is bigger than us, and that's why we need help. Just would like to remind our listeners that we are currently in our annual campaign, and our annual campaign runs from December 1st through January 31st, and we encourage you to visit our website at www.themartincenter.org, www.themartincenter.org, and click on that pretty little red donate button when you get there, and every little bit helps. Even a $5 donation would help. You'd be surprised. So certainly we encourage you to do that. We would definitely like to thank Representative Gregory Porter and Mr. Carl Ellison for spending their time with us today. And we are going to start wrapping up our show. And we will do that, as always, with some closing thoughts for you. And it goes like this. Strength does not come from physical capacity. It comes from an indomitable will. Strength does not come from physical capacity. It comes from an indomitable will. And those words were spoken by Mahatma Gandhi. Mohandas Karamchand Gandhi lived from October 1869 to January 1948. He was the main leader of the Indian independence movement in British-ruled India. He employed nonviolent civil disobedience to lead India to independence, and he inspired movements for civil rights and freedom across the world. The honorific term Mahatma, which means high-souled and venerable, was first applied to him in 1914 in South Africa, and the term is now used to describe him all over the world. You know, we often think of strength in physical terms. The word strength usually makes us think of big, muscular football players, Olympic athletes, or even heavy-duty vehicles with tremendous amount of towing power. But when we think more deeply about it, we realize that there are other forms of strength as well. I believe that what Gandhi was saying in this quote has a direct connection to sickle cell disease. Certainly, although some sickle cell patients may be physically strong, most of them don't have the chance to develop big, strong, muscular bodies. But that's okay, because as Gandhi says, strength does not come from physical capacity. It comes from an indomitable will. The Merriam-Webster Online Dictionary defines indomitable as meaning incapable of being subdued. A secondary definition is impossible to defeat. History has given us countless examples of people who have succeeded in life because they were incapable of being subdued. Martin Luther King Jr., Nelson Mandela, Susan B. Anthony, Joan of Arc, and even Mahatma Gandhi himself didn't change their areas of the world with muscles. No, they changed it with their indomitable willpower. If you have sickle cell disease, I want you to focus on your indomitable willpower. It is your willpower that keeps you going day after day through the many trials and tribulations that sickle cell places in your life. It is this willpower that allows you to beat this condition with every single breath that you take. I know that you probably don't think about this most of the time, and maybe that's a good thing. But there are going to be times when being aware that you have this power can be very beneficial to you. When you feel another pain crisis coming on, immediately start thinking about the enormous amount of internal strength that you possess. Remind yourself that your willpower is indomitable and that you will beat this crisis just like you've defeated all of the others that you've had. Look in the mirror and tell yourself that you are more powerful than the condition that is trying to beat you down. Tell your family members, your caregivers, your doctors, and your nurses that your willpower will not be subdued and that you are going to be victorious once again. After you've done these things, tell yourself that you love yourself. Tell yourself that there are many others, past and present, who love you too. Tell yourself that you are too important to those that love you to waste your time and energy on feeling sorry for yourself. Taking these steps is called positive affirmation. Positive affirmation is often the difference between winning and losing. I know that you want to win, and I know that you will win. I know that because I know that you are a sickle cell warrior. That's our show for today. I'll be on vacation next week, but we will replay our very first show. We'll be back live on December 29th. Please join us, same time, same station, and thank you once again to Representative Gregory Porter and Mr. Carl Ellison for being here.
Thank you.
Thank you, Gary, for having us.